Hi, this is Meryl Moss, and I'm the Chief Operating Officer at Coastal, and I am so excited to be here today with Dr. Matthew Sickett. He is the co-director of the stroke centers at Rhode Island Hospital and Miriam Hospital. He's an emergency room physician, and we're here today to talk about a very serious subject, stroke. One of the reasons that we wanted to have a series of videos with Dr. Sickett and other emergency room physicians is to talk about when someone needs to go to the emergency room and not necessarily call their primary care physician. So let's start with this. I know you wanted to talk about, what is a stroke? What actually happens? So in your best layman's terms, let's give that a shot.
So there are two major causes of the stroke. One is a blood clot or a blockage of blood flow delivering blood to the tissue in the brain. That's far and away the most common cause. About 80 to 90% of strokes are caused by the clotting type. The other form is when there's a rupture in an artery supplying some of the brain tissue, causing bleeding in the neighboring tissue, and that's also very severe.
Tell me some of the warning signs of a stroke.
So stroke warning signs can be highly variable, but most commonly it can be weakness on one side of the face or one side of the body, usually the arm, speech disturbance, numbness, sensory loss. Sometimes even in the back of the brain, it can be a loss of coordination, instability walking, or visual disturbance. Not always is the patient able to recognize the symptoms of stroke themselves, or they may be too disabled to activate 911 on their own. So family members being vigilant of these symptoms is really important.
So what if I have a brief episode and then feel better, feel worse, feel better? Sometimes we try to reassure ourselves. What should you do in that circumstance?
Absolutely. Those are warning signs of a transient ischemic attack, which is commonly known as a mini stroke, and that's also truly a medical emergency. Patients are often reassured when their symptoms go away and they don't seek medical treatment. But oftentimes they're actually experiencing a stroke, or soon thereafter will be experiencing a recurrent and more severe episode. So getting to the hospital right away and seeking that treatment is just as important for a mini stroke as it is for an actual stroke.
So it feels like when something is different, that we should be very careful. I've heard this in terms of people having heart attacks as well, is people feel like, oh, I don't want to bother anybody, and what I'll do is I'll just take a nap and it'll be better. But that's probably not the right thing to do.
Absolutely not. Whenever there are signs of a stroke, you need to seek treatment right away.
So really, same situation, go to the ER immediately.
If we can identify the symptoms of a stroke and seek treatment immediately, then our time-dependent treatments are more likely to make an impact.
Let me ask you this, how can we prevent a stroke?
That's a great question, and there are very common risk factors for stroke that we need to be aware of, and those are high blood pressure, diabetes, high cholesterol, and cigarette smoking. Use your coastal docs here. Optimize, these are called secondary prevention strategies. Make sure your blood pressure is at target. Make sure your goals are clearly laid out, and stick to these regimens so that you don't experience the unfortunate event of a stroke.
Yeah, well, this was terrific. Thank you so much for talking to me today. We hope to have you back and do more of these public announcements for our patients, and hopefully they'll listen to them and act on them. So thank you very much.
My pleasure. Thanks.